Hi, it's Bill, the Knee Pain Guru. Today we're going to talk about how the Quit Your Quack pain relief program can help if you've already had a knee replacement surgery. Now, this could be any form of knee replacement surgery, either a total knee replacement or a partial knee replacement. Regardless, it's important to manage your expectations about what this program can help you with. First of all, your body was in a tremendous amount of pain, trauma, experience an injury initially that led you to a point of having an additional trauma of the knee replacement surgery. And that is a very traumatic experience for your body to go through. Many times on the other side of a knee replacement surgery, people are a little disheartened because they thought they would be able to get back to their life like normal before the knee injury or having problems with their knee. And they're still suffering with lots of pain, range of motion issues, also a whole host of problems on the other side of the knee replacement surgery, and they just can't take the pain anymore. They're going to physical therapy. Physical therapy puts them in more pain. The doctor is saying, well, we'll need to manipulate the knee under anesthesia in order to increase the range of motion. It's just kind of a nightmare what ends up happening on the other side of the surgery. So what I want to do is make sure that is very clear in your mind that we have, think of it like a living room with a huge rock that's put in the middle of it, and our ability to move the furniture around and reorganize the living room is based on that rock being there. And the rock is the knee replacement. So there's factors that come into play in terms of getting you out of pain that can't be, there's a limitation on how we're going to be able to mitigate it, meaning address it, because you have plastic and metal. Bone in your leg has been cut off and replaced with plastic and metal. So there is pain that you're going to experience that doesn't really have anything to do with the knee itself. It comes from, a screw being put down the length of your bone and all of the trauma that your knee went through as a result of that. But what we can do is we can work around that. We can work at the building up of the scar tissue, the stiffness, the range of motion issues and things like that, that we not only have to look at the knee, we have to look at the rest of the body as well. Meaning your hips and your lower back play a huge role in the range of motion in the knee. And if you're only looking at the knee, you're leaving a lot of factors on the table. So in the Quit Your Quack pain relief program, we're going to look at three things. We're going to look at physical, we're going to look at diet, we're going to look at mindset. And on the physical level, we're going to begin to introduce comfort in your knee. Comfort meaning getting the pressure off of the nerves as much as we can, given what we're working with, create comfort in the knee so the knee begins to relax. The leg begins to relax, your hips and lower back to begin to relax. And what happens is that creates more space so your body's not in as much pain. So that's the first step. Second step, we're going to look at diet, and what I'm specifically talking about is inflammation. Inflammation in your knee from the pain, from the surgery, from the trauma, as well as inflammation in the rest of your body as a result of being human, being a human in pain. It creates global inflammation from your head to your feet. Foods that you eat, water that you drink, air that you breathe, just the stress of being a human in pain causes global inflammation. So we're going to look at how we can reduce inflammation both in your knee and in your body so your body can support the healing of your knee faster. So that's the second step. So we got physical, creating comfort. We're going to look at diet, which is we're going to reduce inflammation. And then we're going to look at mindset. The reality of it is getting out of knee pain is not linear. You're going to have good days and bad days. And on the good days, we want to make sure that we keep you from doing things that are going to sabotage the process, sabotage the program. Because it's like the knee feels good and you're going to want to go out and walk more than you normally do. We don't want to throw the knee right back into pain that we just got it out of. So we want to kind of gauge how, when on the good days, how much you're going to exercise or how much you're going to move. And then on the bad days, because the reality of it is, you're going to wake up. On some of those days are going to be rough. And there's a tendency to want to quit. And that's when we really need to double down on creating comfort and reducing the inflammation. What that does is that shortens the duration of the bad days. It moves your body through those bad days faster. Now, I will say this. I've had clients sign up for the program, and sometimes, especially those with knee replacements, in the short term, their pain can increase. Just the reality of it is. And in that case, you need to reach out to me more. You need to reach out to the program more, give more feedback, and say, this is what's going on. And instead of quitting, instead of stopping and saying the program doesn't work, because what's happening is your body's been tensed up and it's protecting itself for a long time. And then you finally start letting go of that tension, you begin to feel more. And there's a lot of stuff that your body's been protecting itself from for a long time. So in that case, we need to double down on comfort to move you through that in a shorter period of time. And what I found, those with knee replacements, they're looking for the quick fix. They're looking for that, I want to get out of pain yesterday, which is understandable. I get it. However, the reality of what your body's been through, it's just not realistic. So if that sounds cool to you, I'm your guy. My program can help you, and it can be a tremendous benefit to what you have going on in your knee, in your body, and make a huge difference in your life so you don't feel so helpless and hopeless as to what's going on with your knee. So thank you so much for listening. Bill Paravano, the Knee Pain Guru, thanking you for being here, and I look forward to seeing you in the program.